My name is Martin Origa. I am a gynecological oncologist in the Uganda Cancer Institute, and I work in the Department of Gynecological Oncology. Basically, it's the unit that handles cancers that affect a woman's reproductive system. The commonest being cancer of the cervix. However, there are others like cancer of the ovary, of the uterus, of the vulva, and of the vagina. The cervix is that part of the womb that is basically the opening. It's the opening of the womb. Commonly in Uganda, it's called omunwa gwa nabana. The womb has got two parts. It's got the cervix and it has got what they call the corpus. The corpus is the main body, the mubiri. The cervix is the munwa. So the cervix is the first part of the womb. Cancer, I would put it in simple terms as any uncontrolled growth that has the potential of spreading parts of your body and causing harm. So if this growth is on the cervix, it's called cancer of the cervix. There's a growth that grows out of control and has the potential to spread to different parts of the body, and the liver, the kidneys, the brain, and in all these places that it spreads, it causes harm. Cervical cancer has been found to be caused by a virus called HPV, which is the human papilloma virus. In our medical practice, we are concerned about 9 types, which are really what we call the high-risk types of virus. The virus commonly is spread through unprotected sexual intercourse, and it begins causing changes on the cervix over a long period of time, close to 12 to 15 years, before actually the actual cervix, before the actual cancer breaks out. Its main mode of transmission is the sexual transmission, and the risk factors around it actually are around sexual behavior. Okay? The more sexual partners you have, the higher the chances of getting the bad type of virus. I also need to put this clearly is that almost all women in their lives will have this HPV infection. Almost all. Yes. However, the difference is if your immunity is good, within a year and a half, you have cleared it. However, if your immunity is lowered, and this could be due to HIV, it could be due to cancer, other cancers in your body, it could be due to diabetes, that can cause this virus to stay longer in the cervix and also increase your chance of having cancer of the cervix. So immunity is an important factor in its transmission. I would say any woman who is sexually active is at risk of cancer of the cervix. Medical evidence showed that there is a reduction in transmission of the virus with circumcision. However, it doesn't stop transmission. There is still a degree that is transmitted. Even a condom has been shown that even with a condom, there is still a degree of transmission of this virus. The other risk factors around it, smoking tends to make the cells around the cervix a little weak, and that enables this virus gain entry and go into the deeper areas of the cervix and stay there longer. HIV in our setting is also commonly associated with cancer of the cervix. HIV and HPV are like cousins. Fortunately, this cancer in its early stages has no symptoms. So as I said, it could take 10 years for it to move from what we call pre-cancer to actual cancer, 10 to 15 years. As medical workers, that gives us a big opportunity to intervene and get it. How? Through screening. That's when we can get this early cancer. By the time patients start coming into our clinic, in the Cancer Institute, with bleeding, with an offensive discharge, with pain, that cancer has already broken out. So the commonest symptoms that patients present with are vaginal bleeding, a bad smelling discharge, bleeding during sex, pain during sexual intercourse, what we call dyspareunia, lower abdominal pain, and often patients also present with complications of the cancer. When it has gone to the other organs like the liver or the kidney, they will present with failure due to these organ systems. Commonly here, the kidneys start failing. So in Uganda, there are three approaches being involved by the government. The first one is vaccination. As I said, this cancer is caused by an infectious agent, HPV. So we do know these high-risk types, the bad types. So around those bad types, we have been able to build a vaccine. So this is what we call primary prevention. We are preventing this virus ever getting into your body. Okay? And currently in Uganda, there is this vaccine. It is in the national program of immunization, and it mostly targets school-going girls between 9 to 12 years who are not yet sexually active. So we advise that after you've started sexual activity, especially at the age of 25 to 30, start coming in for screening. Because that is when we can get the lesions, we call them pre-cancer, before the cancer has really broken out. It's still early. We can do so much. It's a very big problem. In the Cancer Institute, it's the commonest cancer affecting women, both in terms of morbidity and mortality, followed by breast cancer. In our clinic, cancer of the cervix is still the commonest. And as I said, the vast majority, 4 out of 5 women who come in the clinic are really at stage 2 and stage 3. So we are not talking about early disease, but we are already talking about spread of this cancer. So it's a big problem. It's about 41 women per 1,000 live births, which is that is a statistic. I do not have offhand the exact total numbers per year, and out of those, how many have died. But I can tell you that in Uganda, it's the leading cause of morbidity and mortality for women. Oh yes, we do have. Unfortunately, those are the exception. There are very few. I would put it at about 10 to 15%. The rest, what I mean is that those are the ones that come in an early stage, and we are able to intervene and cure. The vast majority come with advanced disease, where we are controlling the disease. And in any cancer, we have what we call the 5-year survival rates. As in, say, if I came in, say, with cancer of my ear, and I got treatment, they are going to follow me for 5 years, and they find out, am I still alive at the end of 5 years? I may be dead, because the disease has recurred and, and all that. So for advanced cancers, it's estimated that within the 5 years, it has come back, and within that time, the patient has got complications and died. So we have very poor 5-year survival rates for cancer of cervix in Uganda because it's already advanced when they come in. My message would be, until these herbal preparations are tested and certified by the National Drug Authority of Uganda, I wouldn't advise anyone to go for herbal preparation for treatment of cancer of the cervix. My general message is it's much cheaper to treat cancer at an early stage than a late stage. The cost of a vaccine is 50 times, almost 100 times less than the cost of treating cancer when it has broken out. So my big message in as far as cancer of the cervix is concerned, it's a big problem, but it offers us an opportunity in that it doesn't just break out suddenly like lightning. It gives us about 10-15 years before it breaks out. So what happens within the 10-15 years? You can get a vaccine, you can regulate your sexual behaviors and engage in more safer sexual behavior. You can start screening early, as soon as you become sexually active. And in all those ways, it increases our chances as clinical practitioners to pick this cancer when it's still early. It's much cheaper in terms of finances, socially, health-wise. It's cheaper to treat cancer at an early stage or before it has broken out than when it has come out. So prevention is my key message.